We just took you inside the black market of beauty. We spoke to several women who shared the same surgery coach and ended up with life-threatening infections and even fatal consequences. We now want to bring in board-certified plastic surgeon Dr. Sej Patel for more perspective on the complexity and certainly hidden risks of these procedures. Welcome, Dr. Patel.
Obviously, we just heard horrible stories about one woman after the other, this kind of turnover factory approach. The procedure you're talking about, how arduous is that? How time-consuming?
It is such a tough surgery. Every aspect of the surgery, there are so many aspects to the surgery. Brazilian butt lift, it involves liposuction, and then it involves a grafting of fat and processing of fat. And it's a long surgery that has major physiological demands on the patient. It requires movement intraoperatively. So from an anesthesia perspective, it's also a very difficult surgery. And it boggles my mind that people think that this is a simple procedure compared to something like a breast augmentation that takes 40 minutes.
I think that is the key here, that this is major, major surgery that you need to be under monitored general anesthesia for extended period of time. And just by the nature of the magnitude of the surgery, there are inherent risks. And in fact, we know here in the States, in the hands of reputable people, there have been deaths. So in my mind, as somebody who's been doing plastic surgery now for over 35 years, I question whether we should be, taking these larger volumes of fat and putting them into the backside of women, because it's potentially a life-threatening situation if you inject fat into the blood vessels in that area. Why did Chris get in too much trouble? This is a free graft of fat. It's seeking a blood supply. If it doesn't get it, it dies. It sits there. It's the perfect fuel for an infection. Or if you try to overstuff the area you're filling with fat, that skin is going to break down. So I think this is, in a nutshell, what happened to Chris. So yes, I'll still continue to do Brazilian butt lifts, but my goal is going to be different, and if that doesn't coincide with what the patient's looking for, that's a flat no. I'm not doing it because I think it's too risky. I think the prudent surgeon is going to back off a little bit and maybe not try to push the envelope.
But I don't think it's just about not being aggressive. I'm extremely aggressive. Out of the 5 patients I did this week, 3 of them had maximum lipo for the state of California, 5 liters of lipo. I'm a very aggressive surgeon. But the only 2 things I care about are your result and your safety. I think that you need to control the environment that it's being done in, and I think that's one of the most important things. Of course, the doctor and the team. I literally manage every aspect of risk for the patient in every aspect of my center, my staff, my anesthesia, the way I do the procedure. It's down to a science.
Can I ask a question? I'm again putting on my layperson's hat. I do worry when a trend becomes normal and people are willing to put their lives at risk. And I'm not talking about you specifically, Dr. Patel. We're going to talk about some of these hidden risks in a moment, but that this quote unquote beautiful body and shape that is surgically contoured and made, quite frankly, in an operating room, when women are willing to risk their lives for this look, I'm, as a layperson, saying, okay, I feel like you guys are taking your profession too far.
What are the real risks of this procedure?
Well, I think now with what's going on, you have to say potentially you could have a fat embolism event, which means you could die. And the American Society of Plastic Surgeons is looking at that right now. Do we have to add that to the standard informed consent for Brazilian butt lift that you could die? So, I mean, that's a big issue. And even in the hands of surgeons like the 2 of us, trained in general surgery and plastic surgery and board certified and a lot of experience, and we're diligent. We try to be safe. We try to avoid these potential problems, but they can happen.